good evening. My name is Gail Brewer, and I am the Manhattan Borough President. And I am extremely honored that tonight we're going to be talking about contact tracing and technology, balancing public health and privacy with four amazing speakers. I want to thank Congressman Nadler. And I want to just say in preparation that this, as we sit here today, we know that the city and the state, the city of New York and the state of New York are both hiring tracers, trying to figure out in July, August, and ongoing how we're going to do this program, keeping in mind those two things I mentioned, public health and privacy. We know that Johns Hopkins is involved in terms of curriculum and finding out how they're going to do the free online courses, which I think went live, are going live this week. They're going to be training both city and state tracers. We know that the state of New York is opening up 5 counties upstate on May 15th, which is this Friday, and we'll be learning how the state works in terms of tracing. And then the city, maybe not till August. We don't actually know when it's going to start. We do know that there will be coordination between the two. The salaries for contact tracers start at $57,000 a year. And I heard from the mayor that 7,000 people had applied for maybe 1,000 spots. We know that this is a way, along with testing and treatment, that we can still open up and stay healthy. But there are many, many issues. It's never been done before. And I think that's why this topic tonight is so incredibly important. So our first guest is Carrie DeSalle. She's a staff attorney at the Knight First Amendment Institute and a lecturer in law at Columbia Law School. Her litigation focuses on freedom of speech on social media and government surveillance. She also runs the Knight Institute's extern program with Columbia Law School. And I know that she's had many litigations along this topic, and she has published and been quoted in many publications, including the New York Times, the New Yorker, the Washington Post, and many, many others. And I think her most recent article, which we discussed earlier, Can Governments Track the Pandemic and Still Protect Privacy? That is certainly tonight's topic. And so Carrie DeSalle, we welcome you and we look forward to you talking about this very important balancing public health and privacy in an unknown world as we try to recover. Thanks for joining us.
Thank you very much, Borough President. I'm very happy to be here. And as you mentioned, I work at the Knight Institute at Columbia University, and we focus on issues of free expression in the digital age, including issues surrounding the ways that new surveillance technologies can burden free expression. And so while we think it's completely understandable that governments, local governments in New York and around the world are looking to new technologies to develop tools to conduct much needed contact tracing as we all consider how to relax social distancing orders and stay at home orders, we think it's important to focus on a number of questions about how these tools will impact personal privacy and potentially freedom of association. So we're very excited to discuss these issues with the group going forward this evening.
Dr. Eldad is an associate professor of biomedical informatics at the Computer Science and the Data Science Institute at Columbia University. She has her PhD in 26 in computer science. Her research is very much about what we're talking about today, the intersection of machine learning, natural language processing, and medicine. And she looks at ways in which observational clinical data, what I consider electronic health records, and patient-generated data can enhance access to relevant information for all of us, particularly at this time. And how does that impact patients and healthcare? She was on the science faculty at CCNY, and now she is at Columbia. So we welcome you. We look forward to hearing from you from a very interesting perspective. Thank you very much for joining us.
Hi, thank you so much for having me, Board President. I'm excited to talk to you about the type of technology we're thinking about for the COVID era and how it can work seamlessly with privacy preserving concerns.
Thank you very much. And next is Dr. Esther Fuchs, who's a longtime friend. She is professor and the director of the Urban and Social Policy Program at Columbia University School of International and Public Affairs. I know her also because she was a special advisor to the mayor under the Bloomberg administration on governance and strategic planning. She also served at the Urban Studies program at Barnard College, and she's founding director of Columbia University Center for Urban Research and Policy, which I know Mayor Dinkins has also been involved with. She has a long, long, fabulous history. I want to say she's also been the initiator of something called Who's on the Ballot.org, which we circulate as the best online portal that tells people how they can vote easily. And in 2020, that is incredibly important. She's also on the Committee on Economic Inclusion of the U.S. Federal Deposit Insurance Corporation, FDIC. She's been on many advisory boards to do with the city of New York. I know, for instance, very much involved with the Citizen Union and something that I love, which is the museum at Eldred Street, as well as JCRC. She is the go-to person in our city for urban policy and politics. She's written many, many books. She has her BA from Queens College. She's very proud of being a Queens girl, and a master's from Brown and a PhD from the University of Chicago. We adore her, Dr. Fuchs. Please join us.
I haven't heard such a lovely introduction in a very long time, and I appreciate that. Of course, I always feel lucky to be on anything that Gail Brewer, our borough president, is involved in, and especially anything that relates to technology and public health and privacy. I'm here in sort of a support role tonight. I'm working with Nomini El Haddad on a project called the COVID Watcher, and we'll talk more about that later. But we are, as everybody knows, facing an extraordinary challenge around this pandemic, and now the privacy issues that are going to be brought up by the need to track. And so I'm happy to be part of a team at Columbia that is working to make sure that community organizations will be part of this process, and that we will collect the appropriate data needed for advocacy, research, and public policy. And we're partnering with the borough president on that. So I'm very optimistic that we're going to do things right in the rollout period.
Thank you very much. Our next wonderful panelist is the beloved Congressman Jerry Nadler. We know that he represents the Upper West Side, but he also goes all the way up to Morningside Heights. He has the Village, and he goes into Brooklyn, Borough Park, Kensington, and other parts of Brooklyn. They're almost too long to mention Jerry Nadler. He began his service in 1976 in the Assembly. He was elected to the House of Representatives in 1992. He is re-elected now to his 14th full term in 2018. And of course, we're going to use Esther Fuchs's information, and we're all going to vote for him coming up in June. He is chair of, most importantly for tonight's discussion, of the House Judiciary Committee. He served there as the ranking member of its subcommittee on the Constitution and Civil Liberties for 13 years. He's a graduate of Columbia University and Fordham Law School. Jerry Nadler, thank you so much for joining us, and we look forward to talking about privacy and health and anything else you want to bring to our attention regarding contact tracing in this very challenging times.
Well, thank you very much, Gail, for organizing this evening's discussion on this important topic. As we come together to deal with these unprecedented challenges, I think we all agree we should do everything possible to harness our nation's spirit of ingenuity and use every tool available to stop the spread of this deadly virus. At the same time, we must resist the temptation to think that there is one silver bullet or one magical technology solution that can solve all our problems. And we must be vigilant to ensure that we don't throw open the doors to new big data programs that can compromise Americans' privacy or be used to discriminate against vulnerable groups. As with any new technology, there is the great potential for beneficial use, and also the great potential for non-beneficial use. So as we get started on this discussion, I'd like to offer up a few principles that I hope can guide the way we use some of these technologies going forward. First, none of these technologies should be used to create new government surveillance programs. We know from experience that these programs almost invariably tend to morph and grow beyond their initial intended purpose. And once they start, they can become almost impossible to dismantle. Second, people's information should be anonymized to every extent possible. And finally, uses of these technologies, of these technologies should have clear, limited purposes. Nobody's information should be shared or used for any reason beyond these purposes, in this case, public health, and everyone's data should be purged once it's no longer needed. So I want to thank our co-panelists for organizing this event, and I look forward to our discussion on how to properly balance the competing considerations.
Yeah. Thank you very much. So I'm going to start with you, Carrie, because I think what you might want to do is just bring up your article, because one of the questions, of course, is, you know, those issues of how do you balance the two that the Congressman just mentioned. But I have to say, I just got a call or question as, you know, how do we make sure it's not stop and frisk? And I think that's what is also on people's minds. So you certainly wrote about this. So I'm just wondering, in terms of data, health, they go together, data and health, but they shouldn't go together for some of the purposes that people are afraid they could be used for. So I was just wondering if you could comment on that.
Sure, I'd be happy to. So I agree. I mean, the government typically bears a heavy burden to justify any kind of surveillance into private citizens'
Carrie,
lives.
we're having trouble hearing you. Maybe you get closer.
Sure, is this better? Okay.
I think so. Try again. Keep trying. Yeah.
Yes. So I think in this instance, it's abundantly clear that there's an incredibly pressing government interest in combating the COVID-19 global pandemic and public health crisis in the United States. The question is how to do that, first and foremost, effectively, and second, while respecting individual privacy and civil liberties. So at the outset, when we're looking to new technology to conduct contact tracing, for example, the first question should really be one for public health officials. What kind of information do you need to effectively trace the coronavirus as it spreads through a population and limit that spread? And then technologists are, capable of coming to the fore and saying, we can build a tool that creates good proxies for that information. Increasingly, we're seeing proposals for the use of Bluetooth technology, which is effectively a proximity tracing tool. So it can enable users of a cell phone to record information about other devices that cell phone has come into sufficiently close contact with, that the person may have been exposed as a result of it. But at the first instance, those questions are squarely questions for public health experts and the technologists working together to determine whether or not we can actually build a technology that will be effective in conducting the contact tracing that we need to help address this crisis. But then assuming we can build an effective tool, there are a lot of questions about how to limit the data that's being collected to the data that's most relevant for those public health purposes. And these are touching on some of the principles that Congressman Nadler just mentioned. But other countries around the world have used location data as opposed to this Bluetooth data, and location data can reveal much more information about a person that's much less relevant for public health purposes. If I go on a long drive on an open road, for example, that's not terribly relevant for contact tracing purposes, but can reveal a lot of information about me to government officials if that's where the data is being sent, for example. So we need to make sure that the data that's being collected is really the data that's most relevant for public health purposes. And then we need to make sure that the data is, as Congressman Nadler said, is anonymized to protect individual privacy and to protect sensitive health information from being disseminated in unjustified ways. There are a number of other questions too about whether the tool is voluntary, whether this is a consent-based collection of information, and we strongly urge that it should be. and there's, in terms of data minimization, a question about how long the data is retained. If it's stored locally on an individual's device, is it automatically deleted after a matter of weeks? After which point, if somebody tests positive, somebody that they had come into contact with 3 weeks ago may not be relevant for a contact tracing purpose. And that kind of raises the question about where the data is stored, whether it's locally on a person's own device versus in a centralized government server or servers maintained by local health officials. We would urge local health authorities, to the extent possible, to allow data to be retained locally so that it doesn't become part of a giant government stockpile that may be put to different purposes down the line. Then there are questions about security and transparency with respect to these tools to make sure that they're not being manipulated by bad actors, and that they can be tested by outside security experts. And finally, one thing I think that's worth noting is, these tools may be limited in their effectiveness within populations that simply don't have access to smartphone technology. Individuals, I think this goes back to a point that maybe you mentioned earlier, that these tools should, if anything, be a complement to broader public health initiatives so that they don't become part of, basically, so they don't really exacerbate the digital divide that I think you've talked about in previous town halls and leave certain communities out of a society-wide public health solution.
Yep. Thank you very much. Naomi, obviously from the public health perspective, there are a lot of issues. When I spoke today to the state in charge of tracing and the city in charge of tracing, the two different entities working together, one of the issues that comes up, of course, is they're going to start with the human tracer. They haven't decided yet, picking up on what Carrie indicated, whether it's Bluetooth, GPS, or anybody doing the technology tracer. But it is ironic because we're all getting calls from every software company in the world saying, oh, we can do this, we can do that. But from a health perspective, which is really what we're trying to accomplish, and our goal is to keep people healthy. What kind of data needs to be collected? How can the human tracers do the best possible job, etc. I'm sort of picking up on some of the questions that Carrie answered. And can it be done on the human one-to-one level? And then do we need more technology?
Right, and so I think you're pointing out exactly the tension that we have right now between what humans can do and what technology can offer to augment the possibilities to help fight against the pandemic. I think right now the general philosophy of this digital contact tracing technology is that it would work the best as a complement to human tracing or case managers, and that we would be able to build technologies that, for example, keep tracks of, as Carrie said, of all the people you've been exposed to in the past 2 weeks, but that because of privacy constraints would not, for example, keep identity of the people you've been exposed to, and rather would go and notify each person directly. And then the case managers would probably help with what to do once you know that you've been notified. Would you need to go into quarantine or anything like that? That would be one possibility of a scenario. There are other scenarios out there where there's less privacy available, where all information is released from your phone that keep tracks of, for example, the contact of the people you've been in touch with, and then it's up to the human contact tracers to contact these people and then maybe decide how much they would want to release for private information. I think there's different scenario out there, and it's not clear which one is the one that's going to win right now. Anecdotally, Google and Apple have a month ago suggested that they had technology available, and they made it. They offered it to many countries and local states and cities, and their solution had complete privacy. In other words, there was no location tracing and no identifiers being kept. It's not, I think right now we don't know who's gonna, which exact technology is gonna be used.
Well, so Esther, I know that you and Naomi working on the COVID Watcher. What is it? Can you pick up on what Naomi was talking about and explain? And then from a policy perspective, how does all of this help the average New Yorker?
So Nomi really initiated this, and I've been fortunate enough to be able to work with her on this immediately to get involved with the need to create a platform for what we like to call citizen science. And this is a kind of wonderful thing because the data collected, people basically agree to have their data collected, and it is anonymous. So from the start, unless people say, I want you to know who I am for whatever reason, the data remains completely anonymous. And it's collected over an app or on the web. And what we've done, and I'm very enthusiastic about this, is we're thinking beyond the health issues around the pandemic. So yes, we are collecting all the data around health issues, which will complement, as Nomi said, the work that's being done by the human tracers and the current identification of people who've been in hospitals and have had COVID and have gotten well from it. So, but that is really insufficient both for health, for health outcomes, and it's insufficient for what's going on in our city right now. That is really the secondary impacts of COVID. So things that Borough President Brewer and Congressman Nadler have to deal with every day now in terms of determining where to put resources because of this extraordinary impact that this pandemic has had on, not on our economies, on people's jobs, on public health, of course, but also on their emotional well-being. And also what we've discovered, of course, is there's extraordinary disparities across race and across income. And so I just want to make my pitch here for the positive uses of data, recognizing that we need to deal with the privacy issues. And so from my point of view, what we're trying to do is engage people and community organizations and, of course, government like the borough president in this process so that we can collect the data that's needed to ensure that resources and policies actually get directed to the folks in the communities who actually need the assistance. And we're asking them these questions, frankly, about what has been the impact. And we're looking at it from an economic point of view, from health, mental health, and social welfare, food insecurity. And we need to be able to target the resources in the high needs populations. And, you can't do it without data. So we're collecting it, I believe, in a way in which we're protecting privacy, but we need to link these different types of data or we're going to waste our money. We know how easy it is for government to waste money. And so this is a plea here, for people to fill out this survey and be a citizen scientist and be responsible. Go anonymous, but help us get the resources and the information to the places that can actually do something. And this is where Gail comes in. The borough president needs to be involved to protect the public here. The congressman needs to be involved to protect the public. And we have now 50 community-based organizations that will be intermediaries.
Right. Well, this is a perfect segue to the congressman because some of the questions, because it's such a smart audience, some of the questions are things like, how do we use this data through contact tracing to make environmental decisions in the future? Or how do we use this data in the future to, figure out where there are additional risk transmission factors? But I would also ask, improve the healthcare system so we don't have all these underlying conditions, which I think, Esther, is sort of what you're stating. So I mean, that's what you have data for. And so, Congressman, of course, obviously you have the vantage point of thinking about all these issues, but what is the Congress's role? Is there a role for the federal government to address some of these needs? Obviously, we're thinking today about this horrible virus and stopping it, but are there other themes and needs that can be addressed perhaps with the data, still keeping that overwhelming issue of privacy? And of course, we're also getting tons of questions about, you know, making sure that something like stop and frisk doesn't reappear. That's a very strong concern. Congressman?
Well, it's a very, very complicated question.
It
And
is.
we're just starting to think about it and just starting to realize the implications of it. And there are no obvious answers yet. Hopefully, maybe there will be at some point. But at the moment, the major need is contact tracing for epidemiology. And that we need to do. But I would say we have to be very careful that the information you collect there is used only for that purpose and only for a short duration, and that it's destroyed after a while, so that it is not, so that you don't build up databases on people and where they go, who they meet with. That has real implications for privacy. The second observation I'll make is that the real challenge is going to be, in terms of protecting privacy, the private sector. You've got these huge tech companies which have which permeate our lives now, which everybody's got a cell phone, everybody's got something which can, various traces of which can be put on it. And the question is going to be for government, how do we limit the uses of that information, or perhaps the collection of that information? And do we say that you can't use that information for any purpose except, or do we have a broader approach to it? I am very leery of very powerful companies having too much information about people. Now we know they're using all sorts of information for marketing purposes. Our committee has an investigation going on right now about overuse of, about overweening power in technology companies in particular. For example, Amazon using information about products on its that are sold on its website to on its platform in order to develop competing products. You have to prevent the accumulation of too much information in one place. That's probably easier to do than to regulate that may be easier to do than to regulate the use of that information. For the narrow purpose of contact tracing people with a disease, that can be contained more easily, but it starts to raise all the questions that we haven't really given much thought to yet, and don't really have great conclusions about yet, but we're going to have to deal with over the next few years.
Questions brought up in the question boxes about the health systems, private contractors, how will information gathered from the tracing be transferred between entities? And that's very specific. In New York City, Johns Hopkins, thanks to former Mayor Bloomberg, is going to be collecting the data that is coming from the state and the city. And the city is using Salesforce and the state is using Vital Strategy for something called case management, which is basically if Gail Brewer is found to have COVID, then I need to be managed, and the people who I'm in contact with, maybe we need food, maybe we need isolation, all that kind of management. So, but all of those folks will have information. Well, they all have data. And I guess my question is, again, from your wonderful words earlier, and you could expand on this, this is a concern. Again, as the congressman stated, it should be not used except for the purposes at hand. But is this going to be an issue? How do we deal with all this? Even though we know what we want, how do we get there? Carrie?
So there are a couple of different ways that the information collected through some of the apps that have been proposed will be stored, or a couple of different places that have been proposed. So as I understand it, the tool that Apple and Google are developing would actually store identifiers of phones that your phone has come into contact with locally on each person's own device. And so that information would actually not be transmitted to any kind of local government authority really at any point. It would be a tool that enables individuals, once they have tested positive, to alert the other people that they have come into contact with that they may have been exposed, and that information would remain anonymous on both ends.
Okay,
So
let me raise a question here.
Mhm.
Would that information be subject to subpoena, for example, by law enforcement? That's where the kind of question we're going to have, we're going to have to address.
That is a great question. I think as far as Apple and Google have proposed it, they actually themselves would not have that data either. So if it remains truly anonymized and stored locally on an individual's device, then as far as I understand it, the government would have to be able to figure out who that person is and get the information from that individual device. I think Apple and Google are basically saying we're not going to be retaining any data on our own. So that is one privacy plus of the tool that they have proposed, and aligns with a couple of other proposals that we've seen out of Europe and elsewhere. There are other proposals where an individual could voluntarily alert the local health authorities that they have tested positive and then upload their the identifier stored on their phone so that the local health authorities could contact the individuals that they have come into contact with. And then I think this goes back to your point, we would want to see strong protections put in place that require the deletion of that data from the centralized server after it has served its purpose.
Wow. Naomi, back to you on, again, trying to figure out, because a lot of people want to understand what it is that the health community is trying to capture. So what I understand is whether it's technology and or human, again, we're going to start with the humans as I understand it. We're going to hopefully do the tracing. We are going to find those that have been in contact, and then we're going to, if necessary, be isolated, quarantined for 14 days. It's a big project. What kind of data are we looking for? Will this work? You know, I'm just, from the health perspective and the work that you've done, is this something that is obviously new, happening in other countries, but from a public health perspective also, is this what you think is gonna work?
Right, and so I think there's really different questions that health officials, public health officials, epidemiologists, hospitalists are looking into, and I would suggest that there are different technological solutions for each of them. So one is an epidemiological question: where is the next hotspot? You know, when is the next wave of the pandemic? And for that, the data that you would need, for example, would be something like that has some location information so that we can tackle where in the city there are more and more positive cases or more and more symptoms indicative of a positive test in the future. But there are other type of questions that hospitalists are looking into, things like, you know, if we want to go and intervene, or if we want to go and make sure that social distancing is actually being respected, we can't just use symptom information and exposure data. We need to understand a little bit better the context of people and their lives. And so, you know, just having this type of data collected might not be enough, might be surprisingly too privacy intrusive, but at the same time not enough to answer the practical question of that hospitalists are trying to answer. And so that's kind of what we're trying to do with COVID Watcher, to have a more holistic view of different groups of individuals. So let me just give you a quick example. If we see that a particular neighborhood has a lot of movement because people are reporting that there's a lot of exposure, is it because there's just no respect for social distancing, or is it because there are effective barriers that are making people having to go into one supermarket only that's available in the neighborhood, for example? So I guess the idea here is that it's something that data scientists know for many years, that there's a lot of biases in data, and the more complete and holistic the view, the more we can go and understand better the context of this data.
Well, that leads right into Miss Policy Esther Fuchs, because the question, you know, from your years at City Hall, it would be great if while we're discussing all of this, we did think about how it can be used positively, which is sort of what you're talking about. And I'm sure when you do the survey and we fill it out for you, that's how it will be used. But citywide, statewide, how can this policy ideas that you're mentioning, that Naomi mentioned, be used in a way that does accomplish that? So it's not punitive, because that's what people are afraid of. People are afraid of it being something that arrests Black and brown people, but how could it be used in a positive way, not only now, but then of course into the future, to talk about all of these environmental and other issues? I mean, you're so on to something. The question is, will city and state government figure out how they can use this data in a positive way? So you can certainly answer that from all of your experience.
Well, I'll try, and I'll try and be brief also. And I appreciate the question, Gail, because it really is about using data in a positive way. So two things have to happen. First, we have to be able to collect sufficient data from communities we know where we already know there's disparities in outcomes. We already know there's disparities in resources. We already know there's structural problems in the healthcare system, in our policing system, that create bad outcomes for minorities, for example, and particularly African-American males, and in a way that COVID is only shining a bright light on things that we know from other forms of data. And we see it, unfortunately, much more clearly now. So I think that part of what we have to do as we move forward out of this crisis and try and figure out, A, what we're going to do, and B, where we're going to put our resources, is that it's important to do two things. One, to do just what Congressman Nadler and everybody, Carrie and you have been saying, to protect the privacy of individuals. You know, we have to ensure that the data is anonymous. That's what we're doing in our data collection efforts. And to the extent people don't want to be anonymous, they can opt out of that if they want. But that isn't necessary. We can do a lot with anonymous data, but we do have to be able to identify geographic locations and communities in order to spend the money effectively. And we also have to know from people directly what are the problems that are emerging for them coming out of the COVID pandemic, and where are they concentrating? And that's where the survey is so important. And so we're collecting this data in a way that's anonymous, but also that will allow us to target policy. You know, who are the people who are really losing their jobs? Who are the people who are getting really sick over the long term, will need different kinds of public health treatments? You know, who doesn't have the computer and technology capacity to ensure that their kids can go online when school doesn't open again? We want to be able to help government and philanthropy, for that matter, answer these questions. And so in order to do that and to ensure that there is no abuse of this data, we feel that the university is a really good place to be collecting the data, and that, you know, we have an elaborate process of human subjects in which we have to demonstrate that our data collection efforts are adhering to a whole set of specifications around individual privacy, first. And secondly, we are working intensely with community organizations to do two things. One, to make sure that we're reaching out to these communities that are often ignored, high-risk communities. And also, we're asking them for feedback on what kinds of questions we should ask. And we are going to provide them with the data for advocacy too. We will provide it to government to the extent that they want to be able to use it. But really, the point is people trust their community organizations, whether it's Citizens Committee for Children or whether it's Jewish Community Relations Council, Catholic Archdiocese. We're bringing on board these kinds of big organizations, United Neighborhood Houses, Citizens Union, the whole range of organizations, AARP New York, OATS for seniors who also have special needs in this area. And so my view is we ensure that government is more responsive if we get these advocacy organizations engaged and give them the capacity through this data to represent the interests of these underserved communities better than they would be able to do if they didn't have the data. And this is where you come in, Gail, especially because of your role as borough president on understanding these neighborhoods. I mean, our efforts are to work with you and your staff, which we've done, because you are an advocate for the interests of all of these communities and understand how to use data. And as that kind of government official, this is very, very important in this context. So that's our structure right now. And we understand that we're not going to get good policy without these intermediary organizations and without the borough president's office like you being involved in this process. It's not going to come out of the agencies, government agencies, without the demand side being activated.
Right. No, I love that question because, of course, I wrote and passed the open data bill, as you know, when I was in the city council. And now we work in our office with Beta NYC. It's a nonprofit, and they have worked extensively for 5 years with both CUNY students and community boards to try to take the current 311 data and other data and to use it for positive in the neighborhood. But this is going to be a whole new level of data. And that's why your work is so important, because as you keep saying, and Carrie and Naomi and the congressman, how can we use this data for something in addition to keeping us healthy? So Congressman Nadler, you've heard all this discussion, please chime in, but I think people want to know two things. They want to know exactly what is the federal government doing in general on data and privacy and health. And then of course, you've got some good questions on a legal front. And then I didn't know if this is a topic that's going to come up in judiciary or if this is something that you have so many other issues you may not be able to address.
Well, this is essentially a new topic, and it's coming up in a crisis situation. Obviously, the federal government has to do tremendous contact tracing. We're not going to get a hold of this. We're not going to prevent huge dissemination of the virus and huge new numbers of victims unless we have extensive testing. And we don't have the testing available yet. We should be doing about 1 million tests a day in this country. We're at a third of that at best. But following up that testing with contact tracing to warn people and to get them to get tested and to quarantine them as needed to inhibit the spread of the virus. That's the only way we're going to inhibit the spread and save people's lives until we get a vaccine or a cure, which may not be, I mean, who knows how long that is? It could be a year, it could be 18 months, could be longer, God forbid. We don't know. At the same time now, so one struggle that's going on politically in Washington is between the know-nothings who are just like the president and others who are just ignoring the need for this type of testing and contact tracing. And by the way, one of the things that means, if you're talking about doing this right, you're going to need probably 400,000 to 500,000 people working full-time in contact tracing. And that's one of the ways, in one sense, that we'll start replacing employment as we start emerging, hopefully, from the depression brought on by the disease. But second of all, the role of Congress, really, as you have, the need for contact tracing is obvious. The technology companies are now coming up with different ways of helping with contact tracing other than just by going door to door and talking to people, which is the old-fashioned way and the way we know how to do it. The role of the Judiciary Committee and of Congress is in many, well, the role of the Judiciary Committee in particular is to make sure that these new technologies, as they are introduced, are monitored, that we watch them, and that we put safeguards on them so that they cannot be used and are not used for invading privacy and for or for other purposes that we wouldn't approve. Anytime you have a major necessity, which we do, the temptation is always to use a new technology or a new means, and then not to limit that new means, because it becomes easier to do other things with it. And that our role is really to explore, I think, to explore these potentials and to put limits on the use and abuse of these new technologies as they become available. In particular, if they can be fielded by very large private organizations, such as the big technology companies, because big companies, big organizations of any sort always have the temptation and the potential to use or misuse capabilities or power for their own benefit, and considerations like privacy get swept aside. Not that they're against it, they just aren't important to them. So we are the people in the Judiciary Committee and Congress, but the Judiciary Committee in particular, who have to watch out as these things emerge and figure out safeguards and limitations.
And you mentioned some legal issues earlier. Those haven't come up yet, but what could they be? There are certainly many.
Well, the major one will be, and it will come up in different forms. Can you use information gathered for one purpose, a beneficent purpose, for another purpose, which may also be beneficent? We're collecting data about people's contacts, and suddenly, should that data be usable to solve a crime? Should it be should it be the subject of compulsory process? And that's not an easy question to answer. You certainly can't say always yes or always no. It's a balancing test, which you have to address. And we're just beginning to think about these issues. I have no easy answers. We're just beginning to think about them as they're just beginning to emerge.
Yeah. So, Carrie, I know that you, again, focused to your credit on the issues of technology. And somebody's asking me, if we don't have a cell phone, is there a digital divide that we need to consider? I know, again, we're still talking about human tracers, at least in New York City and New York State. We haven't gotten to the other ones yet. I don't know that there is going to be another way to handle any kind of a tracing technology-wise if you don't have a cell phone. Am I wrong about that? Or maybe you could just talk about how you could do just generally some of this digital divide issues, or what might we learn as a result of taking this data on the digital divide issues?
Yeah, I think that's an incredibly important point to keep in mind. And I am not aware of any technology proposals that would use other tools or devices other than smartphones, basically, at this point. And so in terms of the digital tools being proposed for contact tracing, I think they are limited in that way. And that raises the question of whether or not these old school tools, the human contact tracing with trained individuals and kind of mass deployment of a lot of people in the coming months, may be a better solution than some new technology. And our visiting scholar at the Knight Institute, Amy Kaczynski, has really advocated for something that she calls the Community Health Corps, which is a works progress administration style deployment of hundreds of thousands of individuals, both for contact tracing purposes, but also community health advocates and liaisons to really do the kind of on the ground work that's necessary to reach communities that are, victims of this digital divide.
But wouldn't they also need, I think that's a great idea. I know that Council Member Mark Levine, who's chair of the Health Committee in New York City, has been talking about that also. Wouldn't that also involve some kind of tech component? Because obviously you collect the data, technology-wise, you still have to figure out how to use it. So how, just in terms of we keep going back to this privacy issue, and also how the data can be used for other than its immediate purpose. That's positive. We have to worry about that. But is there some other apparatus that would go with a community health corps? I know it's been talked about a lot in terms of technology.
Yeah, I suppose in terms of compiling data that's being collected on the ground into some kind of mass resource for public health advocates to use. And it seems as though that actually kind of aligns with a lot of the aims of COVID Watcher. And it's understandable that there are, a lot of really beneficial and admirable goals that come out of these programs. I think the question remains, I guess I would push back on the urge to repurpose this data for any other, even beneficial use going forward. I think when we have a national crisis like the one we're currently facing and we roll out any new kind of surveillance technologies, we need to make sure that those technologies are very narrowly tailored to serve the immediate crisis at hand. And it can be that those technologies serve as a model going forward that we kind of refashion to serve other purposes. But in order to justify a very significant intrusion into individual privacy and a burden on free expression and a free association, those limiting principles need to be strongly maintained, I would argue.
Okay, so Naomi, that certainly fits into, people are asking about the intersection of socioeconomic factors and the rate of spread. And even if we use the tracing, as you heard, just for purposes at hand, obviously the health of all of us, we want to use it for other, because we think that maybe other purposes would help address other needs. That's really another tension, because I'm always thinking about, privacy and health, but now we have another tension, which is what can we use, if at all, maybe we shouldn't, the data for some of the things that you and Esther are talking about. Are there other health needs that it could be used for? Should it? People really are now asking even more questions along those lines. Naomi?
I'm unmuting myself, sorry. No, you're absolutely right.
I have to move this.
There are some, some of the pros for reusing data. I think COVID is particularly interesting because we don't know much about the disease, right? From a scientific standpoint, we're still trying to understand who is more at risk, which therapies work better for which groups of people, and reusing as much data about our patients and their prior medical history, for example, would help us understand better how to fight the pandemic from a medical standpoint, from a therapeutical standpoint. So that's, for me, that's a very strong tension and a very strong point in favor of reusing and meshing together different types of data. The other type of pros that I'm thinking of, that which we do somehow in COVID Watcher, is you mentioned open data about New York City. We overlay information that we gather from our communities on top of data that we already know about New York City. And so again, by putting together these two streams of data, we can, we're enriching our knowledge, basically. But you can imagine all the negatives and all the unintended consequences that would come out of this, right? The more data we mesh, the more potential misuses of the data. So I think we're in the tension is particularly strong, I think, from a biomedical standpoint. How do we keep on learning about the disease? Because we need to find the right therapies. We can't just hope to not get the virus. We also need to know what happens once we get infected. And so how do we find this information without impeding on people's privacy by reusing data in a way that wasn't intended in the first place?
Can I interject here? Maybe part of the answer to that is to do two things, or a combination of two things. One is to aggregate data. In other words, you look at data from neighborhoods or from different socioeconomic groups or whatever to find out different impacts of the disease or different incidences or whatever, without attributing it to individuals. And the other is the flip side of that is anonymizing the data on the individual basis. There are weaknesses, obviously, to both of those, but some combination of that might be very helpful.
No, I agree with you entirely. I think that's right now, that's the strategy we're taking, the approach we're taking, and to think at an aggregated level and thinking about what granularity is the one that gives us the most information is part of the fun questions here. But that works for our use case. What are the next use cases in a year from now? It's actually a little hard to know, right? Like, I don't know, when we talk to community-based organizations, when we talk to infectious disease experts and hospitalists, we understand very well the information needs of today and I want to say the next few months. But to quote one of our investigators on COVID Watcher, who's an infectious disease expert, the pandemic of early March is very different from the pandemic today. And, knowledge and needs are changing constantly. So
Yes, knowledge and needs are changing constantly, but one thing that may give you some information, some hints or correlations.
Yes.
agreed.
So then I'm back to Esther, because one of the questions that I have listening to that conversation between the two previous wonderful speakers, the Congressman and Naomi, is there going to have to be legislation or different policies in order to do some of the things that Congressman suggested? Because I are of the belief that I would like to see this data, because I use it all the time for my community boards, for making local planning decisions, et cetera, with the 311 and other kinds of data. And we are able to plan differently because of it. So this would be, to be very honest, very rich for local planning purposes. How can we improve the healthcare in X community, et cetera? But how do we accomplish this? Because it is very much frightening people to know that this data is out there. So I don't know if we want to get rid of it immediately. That's one suggestion, but then we don't have it to do the planning. There's lots of challenges here that are, even in this hour, becoming even clearer to me, because I'm just focused on the topics at hand. But I guess, Esther, you're the one that's been at the center of the world at City Hall, and certainly similarly now thinking about this policy. So, there's correlation, there's the issue of the individual and the aggregate. How do you think we have to proceed on these issues?
Yeah, there's no question that you're pointing right to the heart of the issue right now, and that Congressman Nadler is correct in talking about aggregating data and not looking at the individual level. The healthcare people and the infectious disease people have a different challenge, to be honest. They need that individual level data. But we in policy actually can do a lot with data that's anonymous, that it's not at the individual level, that it's aggregated either geographically or by particular kind of demographic groups. And that's what we're doing. And so in the spirit of the work you've done, Gail, for community boards, we could use, a community board as a geographic unit and map our data, and then use the public source data, as you're pointing out, whether it's census data or whether it's 311 data or whether it's agency level data that is aggregated and not individual, to inform policy in a smart way. We can figure out, sadly, problems in our city and almost anywhere in the country tend to concentrate geographically. Poverty concentrates geographically. Even old people live in places geographically that are concentrated. We have those, naturally occurring retirement communities, right? The NORC. So we actually don't need the individual level data to make smarter policy around what are the secondary effects of this COVID pandemic now and how they're going to impact people's economic well-being, their social well-being, and also the capacity to get their kids educated in school. So within those three policy areas, I think the kinds of data that we're collecting in the COVID Watcher, connected to the data that's already public, will be, and being informed by the Borough President's Office, the city council members and community organizations, Congress members who care, like Congressman Nadler, who care about local issues. To the extent we can bring all these pieces of the puzzle together, then the data gets used in a much more effective way to inform not just new policies, but also where we spend our money. Our city and our state is going deep into a fiscal crisis right now. I don't have to tell the people on this panel that. And so yet the needs are going to be higher than ever. You know, I want to be able to impact that conversation through the community organizations and the electeds so that we ensure that we don't make things worse as a consequence of the COVID pandemic.
Yeah. So Congressman, that's an interesting discussion that we're having, I think, because as I indicated, health and the issues of privacy, but now we're talking about how we use this information. You've got the whole country in a sense, even though you're our wonderful local congressman, you still have the whole country that is under your purview with all of your shared colleagues. Are these discussions taking place, do you think, elsewhere? Obviously, tracers, testing, tracers, and treatment. I call it the 3 T's. But then in addition now, how do we use the data? Can it be used for other means? Is that something that you think will be thought of by the federal government and the House and Congress?
Not in the immediate future. I haven't heard this. The discussion is really on two different levels. On one level, there's the discussion, the debate, shouldn't be a debate, it's open and shut really, of should we have a lot of testing and contact tracing? Yes, we should, we must, but for obvious reasons. The president, his administration, a lot of the Republicans, for non-rational reasons, as far as I can tell, are not in favor of that. But it's clear that as a matter of epidemiology of limiting the spread of the virus, we have to do that. But people are talking about that in the context of personal contact tracing, in the context of recruiting an army of people to go out and do that. Quite separate, and that's the discussion that's going on now. And in the bill, by the way, that was just put forward today by the Democrats in the House that we may vote on Friday, there's a large sum of money to hire a lot of people for precisely that purpose, for testing and for contact tracing. Quite separately from that, you've got these big technology companies, which are massive companies, which are not accountable to anybody really, and which are developing, among many, many other things they're doing, they're developing these apps, and they may have very good intentions on that too. But these apps and their applications raise the questions that we've been discussing. That discussion is just beginning, if it's even begun. As I said, the Judiciary Committee has been holding a series of hearings on really on an antitrust basis, looking into various practices of the tech companies, but it hasn't been concentrating on this because this is really just coming up now. It'll become a bigger discussion topic, but I don't think there's much focus on it now at all. It will come, but right now, most of the, and it may come too slowly because the tech companies may come up with ways of doing contact tracing based on high technology, which are much more efficient than the way we're thinking of doing it now. And there may be great pressure to implement that quickly without the thought about their privacy implications having really begun yet. And we'll have to play catch up on that.
All right. Carrie, there's a lot of questions in the chat. I mean, one of them is what exactly is the method of protecting privacy? Now there's two different ways, of course. In New York right now with the individuals and Johns Hopkins, plus the two companies that are working on case management, how that's going to work, I don't know. You might have some ideas. And then of course, people want to know if you have aggregate data, which has been
I guess Gail is on her way back. Carrie,
Um,
I want to talk about privacy.
I could try to answer the first question, I think. Oh, Gail, we have you back.
yes, I'm here. I'm here.
So I guess just with respect to the first question, What are the measures that we can put into place to protect privacy once this information is collected? Yeah, so I think, there's an initial question about where the information is collected in the first instance. As I mentioned before, if it's stored on your device and the only information that's stored is anonymous identifiers from other phones that your device has come into contact with, that's a very privacy protective way of keeping data for the length of time necessary to alert anybody who may have been exposed to the virus. But it's a very disaggregated way of storing data. So to the extent Johns Hopkins or other institutions are collecting data and storing that data on centralized servers, there are a number of questions. Basically, those institutions are going to need to make representations, and it could be that lawmakers need to put into place privacy protections to which institutions will be beholden. So again, questions about how securely that data is stored, whether it's stored anonymously and in an aggregated way, whether it will be deleted after a certain period of time, and whether the deletion protocols are made publicly available so that outside security experts can kind of vet them. Those are all steps that an organization can take to increase the privacy protections in place for the data that it's collecting and storing. But ultimately, if it's a private organization collecting that information as opposed to the government, we don't necessarily have the Fourth or First Amendment to invoke to hold them to account. So we either need lawmakers to step in and put into place strong privacy protections, or we as a public, particularly if we're going to be deciding whether or not to voluntarily participate in one of these systems, need to just demand the information necessary to make an informed choice about whether to participate. And I think this goes back to something that it seems that Kovat Watcher is trying to do. The more privacy protective these systems are, the more willing people are going to be to participate in them. So the two can go hand in hand to really serve the overall health goals of a particular tool.
Yeah, I would, if I may add to this,
Yes.
I think, I like how you put the institution and private organization. I think one scenario that's been really working is the one of research, and institutions that have research boards and have these very stringent laws about consent, transparency, risk benefits ratio, and privacy of participants have been, I think, very useful for us as guidelines. And in fact, some private or institutions can opt to follow these guidelines. So for Kovat Watcher, for example, our data is stored on HIPAA certified servers. So it's treated as if it was clinical data. And any data that, if someone wants to give identifiable information, is stored separately from the data related to COVID and other things. But again, I think these type of guidelines exist in other areas, and I think it might be a nice opportunity here for tracing capabilities to think about what IRBs and research institutions are doing.
Gail, this is really important what Nomi said, because this is a model, and Congressman Nadler, you might look at it. This is a model. The data for Kovat Watcher is stored on a HIPAA certified server. And that is very powerful protection for privacy, whereas we can still aggregate, as the Congressman has suggested, but it's not, we don't identify individuals at all. And so there is standards, and I just want to emphasize what Nomi has said and what Carrie has pointed out as the issue. But we can do this and still not lose this data that you, Gail, pointed out, we need now to effectively deal with this pandemic.
Yeah, I think, Congressman, I think one of the ways to do that, obviously the questions are, is there legislation addressing the privacy concerns and necessary data protection? And you could answer that. But the other way to look at this is, how can community groups, and this is what Kovat Watcher is trying to accomplish, how can community groups and community groups of color be empowered by their own data? In other words, how can they find that it's something that's useful to them? And then obviously when you have a self-interest, then you're more comfortable and willing. Obviously, the fact that it's on a HIPAA censored, certified database, that helps. But I think people also have to feel that it's something that
Yes.
they can be empowered with. But Congressman, I think those are two good questions that are coming in from the public. Is one, of course, is there any pending legislation? I know you're working on that with Amazon and some of the large companies that will address these privacy concerns. And then just generally, I do love that notion that this data can be used by not just individual CBOs, which I'm more familiar with, but I remember when I passed the open data bill, guess what my best constituent was? The other agencies.
Right.
They were so excited that there was data because it had been siloed for so long
Right.
in their individual
Wow.
agencies. So I was wondering, Congressman, if that's something, this is a national effort. As you said, 500,000 tracers. Goodness knows how many tech companies involved. We have no idea. And how could it be used for the best purposes? I'm not going to get into who's in the White House right now, but looking into the future.
Well, looking into the future, history is a guide. History tells us when you have a new technology, a rapidly emerging new technology, and a felt need, it gets used, and constraints on it come along a little later. People see how it's used. They don't like the way it's used in certain ways, and you develop a more sophisticated understanding of the potentials and of the dangers, and you develop restraints. My suspicion is, I'm not aware, by the way, I mean, I'm sure people are developing various pieces of legislation. We have some we're looking at now, but it's really at the beginning of the process. And this pandemic is going so fast, and the necessity to deal with it is going so fast that within very broad limits, I suspect that any technology which looks like it's going to really help is going to be used. And we're going to be left afterwards trying to say, hey, wait a minute, okay, but now we have to put limits on this technology for the future or for other uses. History suggests that it's not going to be, and history suggests, and the speed of which things are going suggests that it's not going to, that we're not going to be able to put really effective limits on these new technologies right away. That is to say, in time for use in this pandemic, but maybe in a year or two down the line, we'll have a better idea, because it's going to take a lot of discussion to reach some sort of consensus on how to get the beneficial uses and how to limit it to avert the dangers. And there'll be fights about that. Where do you draw this line? Where do you draw that line? But it'll take a while, even without the poisonous partisanship we have in Washington now, but even with all the goodwill, it'll take a while. I would think a year or two to come to some sort of consensus on proper limits on this. And that'll be informed by the experience we have over the next year or so with the pandemic, and with the extent to which and the cost of which, the extent to which the technologies can help us, and the costs that we see in privacy or anything else of the use of those technologies. So what legislation is pending at the moment is not likely to pass so quickly, because there is nowhere near, people haven't given enough thought or had enough experience with this to deal with a brand new area yet. Okay.
So Carrie, I know that you have some leeway to think about these issues as being part of the Institute, the Knight First Amendment Institute. And I love that one of your either students or colleagues was thinking about the possibilities of having these colleagues working on healthcare, something like the WPA, although I love the art that came out of the WPA, but I know we have a different problem that's presenting us today. So my question is sort of picking up on Congressman Nadler, where it could take time to react, legislatively to some of these concerns. Is that something that at the Institute you've been thinking about, or we just are too early?
Gail, excuse me, let me just add one thing before you get to the next question.
Sure.
Go
ahead.
In previous emergencies, such as 9/11, the danger has not been the use of existing laws and technologies to react to the emergency. The danger has been hastily passing legislation which invaded privacy or civil liberties, like the Patriot Act. That we will have to make sure, and the potential is there for that too. potential is there for someone to come along and say, well, somehow you could help the public health if you did drastic things to limit people's privacy or invade their or whatever. That we have to oppose. And that may be the greater danger than the greater immediate danger.
Good. Carrie, with all those wise words, can you think, is that something generally that the Institute has been thinking about, or is it really too early, as the Congressman indicated?
No, we certainly have been thinking about it, and we definitely share the concern that new surveillance authorities tend to set new baselines, and that's something that we fight against and would certainly do so here. In terms of looking at the new proposals for contact tracing apps, and I would just draw a distinction between COVID Watcher, which seems much more kind of community-based, and the survey itself is a better tailored solution potentially to getting the exact information that's necessary to serving public health needs than these more specific contact tracing apps that sometimes are proposing to vacuum in lots of location data or other information that may be less relevant for the immediate public health needs. But with respect to these proposals, we're taking a close look at them and evaluating them based on the privacy protections that they're putting into place. And it does seem like some proposals have taken steps to incorporate some of the and address some of the concerns that we've already discussed this evening. But to push back against other proposals we've seen out of other countries, like China and Taiwan, for example, heavy reliance on location tracking and the collection of sensitive health data to really enforce quarantine orders and limit public mobility in a way where this information is kind of stockpiled by local law enforcement and may be used for other purposes going forward. Those kinds of contact tracing apps or reliance on new technology and new surveillance tools to combat the coronavirus raise serious concerns for us. And if any local or state or the federal government in the United States were to propose adopting something similar, we would think long and hard about the Constitution and whether or not there is litigation to be pursued in that area.
Right. Can you just talk, even though I think I know people are confused about GPS and Bluetooth and the difference between the two. I think I know, but maybe if you just explain it, because I spent a lot of time working on GIS and mapping, and Bluetooth is obviously something more current. So if you could just explain the difference, I think that would be helpful. And if there is a difference in terms of what you think would be appropriate, if anything is appropriate in the future.
Sure, and maybe that Noemi has more specific expertise in distinguishing some of these tools than I do, since I'm not a technologist exactly, or at all. But the difference between what I was referring to as location data, that can be kind of the GPS data that cell phones collect, or cell site location data that's collected by towers, and really can track every single movement that a person makes over time. And for folks who are interested, the New York Times actually had a really interesting feature that showed what kinds of information could be revealed about a person through the collection of location data specifically. And it's not always very precise. It may be that you're inside a building, and so the cell site location data doesn't reflect exactly accurately where you are. You may have experienced this if you're trying to hail a rideshare car and they don't know where exactly to pick you up, something along those lines. But Bluetooth technology is a kind of lower level technology that basically pings nearby devices, as far as I understand it. And so it can, for example, if you have a wireless keyboard or mouse or speaker, what it's looking for is nearby devices that it can pick up a signal from. And so it seems from our perspective that for contact tracing purposes, this is actually a better tailored tool to achieve the goal of determining who has come into close enough contact with another person that they may have exposed them to the coronavirus.
Right, I agree completely. And the groups that I've been working with are saying the same thing. GPS can be quite invasive. But Naomi, if you want to pick up on that or add anything else, just in terms of what people are, how people are looking at getting the best information from a health perspective, and what, we're still back in this challenge of doing it the right way. So please add to.
No, I would say
go ahead.
I would simply add that, and that was exactly the right distinction between the two. I think they really are talking about different information need. One is exposure and the other is location. And so, I think thinking about what exactly do we need a little bit of everything, right? And so each different solution might involve a hybrid that has some sort of aggregation, some limited location, and some exposure data through Bluetooth is likely what's going to end up for those generic contact tracing technologies.
So from a health perspective, is there one that you think would be better, or is it a hybrid, or we just don't know yet?
I think we don't know. I think, again, for the epidemiologists interested in where is the next hotspot, they want to know location. For the people, for the one-on-one, if I want to be notified as an individual, whether I should go and quarantine, then Bluetooth is all I need. And I just need to know that I was in the periphery of someone who later had some symptoms. So, again, I think it really depends on which question we're trying to answer.
So these are fun questions, Esther, right up your alley. So somebody wants to know, if people own their data, can they be compensated for its use? I mean, people really do think of everything, Esther.
I love that.
Go
And
ahead.
I've actually had that conversation with a lot of your buddies up in Harlem when we've been working with them on a project, rightfully so, for any kind of even research when you collect community level data. Right now, Google collects your data and sells your data and you don't get a nickel. And so Nomi can talk to the technology aspects of this, but there are, some people call them community-based clouds, in which you're collecting localized data, and that if you want to monetize it, meaning sell it to somebody, you still own it and you become part of the sales process. And I think we're, to the extent we will be collecting more data, the privacy questions are so important and we have to deal with them. But we all know that the horse has left the barn on this data collection issue, that as Congressman Nadler said, the technology companies are way ahead of all of us, and we're just learning now, and then we need to wait while government develops legislation to essentially regulate this. So the data is being collected, and I, for one, love this idea, Gail, of that communities should own their data and be able to monetize it in the ways that now these big companies like Facebook and Google, especially Facebook, are just taking your individual level data and selling it. And you probably signed something that you don't know you signed, giving them permission to do it.
Yeah. So Congressman Nadler, these are such fun topics to think about, except that we're actually trying to solve a health crisis at the same time. Are these issues that are helpful to you as chair of Judiciary in trying to think of, even though you're made the clear point that we shouldn't jump to conclusions, we should think before we do things like the Patriot Act, God help us. But are these helpful discussions for thinking about these issues in Congress?
Well, these are certainly helpful discussions in raising these issues. And they're emerging issues we're going to have to deal with. And yes, therefore, they're very helpful. Again, the question is the time frame. The pandemic is going to hopefully be gone soon, but these issues are going to remain. And one thing that this is doing is pointing a spotlight at these issues, but we're coming at it also from a different angle. As I said, our committee has been holding a series of hearings on the tech companies from the point of view of their use of information and their power in society, and an antitrust point of view, which we have to address. So I think it's really not so much the pandemic as the development of these huge organizations, these huge companies, which assemble all this information and monetize it and use it for their own purpose and pose challenges to privacy, which are raising these issues, although the possible privacy challenges of contract tracing in terms of the pandemic are spotlighting these issues in a certain way. But the issues are broader, and they're emerging from the technology and from the gargantuan size of the companies that have emerged in the last 20 years. And we're just beginning to think about it.
Yeah. So Carrie, we have to wrap up in a few minutes. I don't know if you want to make some closing comments. That certainly we've addressed a lot of issues today, and I think your article does even more, but I would love to hear some closing comments from you as to where you think we're going in terms of the issues that you brought up.
Sure.
Well, I'll be happy to issue some closing comments, but I can't say where I think we're going other than that these are huge new issues and huge new fields. We're going to have to think about them and look at them carefully and balance. There are tremendous potential upsides, certainly in contact tracing in the pandemic, and maybe in other ways that we'll look at, but also tremendous dangers to civil liberties and to privacy. And I suspect we're already behind the 8 ball on addressing those, but we have to address them and study them and address them. And I'm glad, I want to thank you for organizing this forum to help focus our thoughts and to help us start addressing or start thinking about these issues.
Right. So Carrie, what would you like to say in conclusion?
Yeah, I think Congressman Nadler put it very well, but we need first to look to public health experts to tell us what information they need and work, closely with technologists and public health experts to develop the tools that they need to actually conduct effective contact tracing, which, by the way, is entirely predicated on widely available testing. So these things go hand in hand. But assuming we can come up with effective tools, really making sure that they are very well tailored to the immediate task at hand and do not create some new long-term surveillance system that can be repurposed for, in many different ways going forward. I think the Patriot Act and the 9/11 example is an apt one. And so we should just be mindful of the pitfalls of relying too heavily on new technologies in a crisis setting.
Naomi, before I call on you, I just want people to know that if you go to neighbors.columbia.edu/COVID-19 tracing, you'll get this entire fabulous discussion from these panelists. So Naomi, do you want to make some closing comments?
Yeah, first of all, thank you for having me. It was a lot of fun. I think it's particularly complex, as we've seen from the discussion, because we're dealing with complex technological concepts, GPS, Bluetooth, etc. We're dealing with complexity of a disease we don't understand yet. But there are existing frameworks for us to think about to guide us a little bit. And privacy is one of the dimensions, but consent, transparency of the type of technology we're building, the benefit for society versus the benefit to each individual. Those are all different kind of questions we want to ask ourselves when building these technologies.
Okay. Esther Fuchs, do you want to make some closing comments?
I'll quickly say that, first of all, Borough President, I'm so glad you put this town hall together. And that to me is the optimistic note that I take away from this. We're on Zoom on the town hall being led by our borough president, and the public is being given an opportunity to engage. And so what we're demonstrating right here, right now, is that we can use technology effectively to create the public good, to support the public interest. So the problem, in my view, is not the technology, it's us making sure that we use it for good. And this is just another example. All through history, this is always a question we've had to answer, and we've had to come down someplace on this. We need to answer this question affirmatively. We're not going to go backwards. We're not going to ignore technology. We have to come together in these kinds of fora and support our public officials who are grappling with this issue to use technology for the public good. Thank you so much, Gail.
Well, thank you. This is an amazing panel. I think none of us would know exactly where it was going to end, but I have to say, as somebody who's done a lot of these discussions, this is the one that has given us the most new, as the congressman said, emerging information. There have been some calls about how do I become a tracer? How do I learn about this? Well, the answer is If you go to manhattanbp.nyc.gov/sign up, you'll get our newsletter. And we have been listing very strenuously, trying to get information that tells you you have a state website to do that, you have a city website to do that, and we have all the information there. You can certainly go to the state or city websites in addition. So thank you very much, Columbia University. Thank you to these amazing panelists. And I hope that this discussion, I'm sure will continue, because it has a lot to do with public health, privacy, and then how can we use the data for good in our communities. Thank you very, very much. I'm Gail Brewer, Manhattan Borough President. What an honor. What an honor. Thank you so much.